So, all right. Well, while we wait, I'm going to introduce myself. I'm June Noto. I'm the Vice President of Information Technology, Human Resources, and Administrative Services for NJAMHAA. As the graciousness of the Division of Mental Health and Addiction Services, we are hosting this webinar on at their request. Suzanne Boris is got a title of about 9,000 characters in it, and she can introduce herself. Take yourself off mute, please. Tell us about what you're looking for. Talk about the Discovers money a little bit, and why you feel that recovery apps are as important, and you're giving them the level of importance that you are.
Sure. I'm Suzanne Boris, and I'm the Assistant Director for the Office of Planning, Research, Evaluation, Prevention, and Olmsted. And we've been getting a lot of federal funding to help address the opioid crisis and other SUD crises. And one of the set-asides we have for our supplemental block grant funding was to help agencies improve their technology to better serve clients. So one of the things I had hoped to see was some providers may be acquiring recovery apps to assist their clients to that are, to support them in their recovery journey. So these apps typically, there's different companies, we're not acknowledging one over another, but still they do exist where, a client can access the app and get additional supports if needed when maybe the agency is closed or the hours are off or something like that, that the app is always there to help support them in their recovery. And as I said, we have funding set aside for this. A communication has gone out to agencies several times. I believe I've talked about this at many meetings, our PAC meetings, our quarterly provider meetings, that there is funding available to agencies to acquire some IT to assist clients in their recovery journey.
Thank you, Suzanne.
Thank you, Suzanne. So I'm going to move now to our host, essentially, our presenters at Gomo Health. And so if you guys want to take it away, please introduce yourself, Coralee, introduce you and your associate with you. And I'm just going to mute myself and sit in the background. And if anybody else comes in, I will admit them to the meeting. This meeting is being recorded.
Thank you for having us. We were super excited to be here. So we'll introduce ourselves, let Deena introduce herself, and then we'll jump into the PowerPoint. And I like to show you kind of the nuts and bolts of it, because I think that would have really helped me with my understanding of it when we first started. So my name is Coralee Schmitz, and I'm the Chief Operations Officer at Rimrock Foundation.
My name is Annette, and I am the Director of Peer Support Services. And I'm excited to tell you how this has helped our peers engage with the clients that we serve, and how this has really overall helped our clients reduce relapse rates and remain in recovery. So
and then Deena, do you want to introduce, and then I'll go into a little bit about
Coralee, just give it two minutes on what Rimrock is.
Okay, so Rimrock is a treatment center in Billings, Montana, and we are CARF accredited, state approved mental health and substance use disorder facility. We have all ASAM levels of care, including 3.7 crisis stabilization, 3.2, and all the way down the line to level 1 for SUD services. And then for mental health, we do, like I said, the crisis, mobile crisis, and then individual mental health therapy with all of the branch offs of that, the DBT and the PCIT and EMDR and all of that kind of stuff. Our biggest piece that I'll talk a lot about today that we really use, we use Gomo throughout our programs, and I'll explain a little bit how it's different depending on the program. We have our treatment court programs, and I'm not sure how many treatment courts are on the phone right now, but we have 7, we provide the treatment for 7 courts, and from misdemeanor and felony, co-occurring and substance use, veteran, Indian Child Welfare Act courts. So it's an array, and I think that's important just because you can see how Gomo can tailor what you need for your unique program. So even if your program might just be outpatient or just mental health, or maybe you have the full continuum as well, it can grow or contract to whatever your program needs. So I think that's really important to understand, that just because we have this doesn't mean you have to have this. It's more just to show you the different options. So that's my elevator speech. And then there's Deena, who was our amazing counterpart through this whole thing. And if you ever get her talking about her life stories, they're fabulous, but that's for another time.
So I will give you the short elevator speech. I'm Deena Cohen with Gomo Health. I'm Director of Community Affairs and Development. I'm a CADC here in the great state of New Jersey, and I'm the subject matter expert that works on all our maternal child health and SUD programs with Gomo Health. And I help work closely with Rimrock, went out to Montana, met these amazing women, and helped build the program from the ground up, and have been working with them for 3 years and watched it grow into the amazing program that it really turned into. And we zigged and zagged and, you know, made it work. And it's a living document and it grows as needed. And it's been just fabulous to work with them.
Okay, so I'll jump in. If you have things that you want to ask questions, if I'm not clear, feel free to stop me. It doesn't have to be formal, and wait for the question period. So, okay, I'm assuming everyone can see my screen. Tell me if you can't. And we'll rock and roll. Oops, oops, oops.
Okay, can't see it yet.
Oh, sorry, I didn't click the word share. That's helpful. Okay,
Got it.
all right. There's us, 10 years younger, but still us. Okay, I told you a little bit about Rimrock. So what Recovery Pathways is the name of this program, for lack of a better word. And so one of the concepts that was really hard for me to grasp and to figure out how to explain it is it's not an app. It's a platform, is how I describe it to people. Just, and Bob is probably saying that's not right, Coralee, but that's how I describe it, because that makes sense to people.
You go, Coralee.
Okay, so it's not an app. It's a platform, and there are 3 main areas to this platform. There's so much to Gomo that sometimes it can be overwhelming, and so in order to sell this to the staff here at Rimrock and to our stakeholders, I had to figure out a way to simplify it in a way that made sense and made people interested and care about it. So overall, what Gomo provides to us at the very beginning was kind of a list of they call it their concierge playbook, which was fantastic because I could use that with our major stakeholders like our judges and our city officials. But then with the staff, I could simplify it a little bit to try to get them to understand it. These are the main areas that we're going to be looking at. I'm going to spend a lot of time on the client piece and then show you a little bit about the support person piece. But these are the 3 biggest things it does. The care messages, which are text messages to the client. The Gomo chat, which Annette will talk a lot about because it's peer support. In our world, it's peer support who runs that chat. And then the care companion, which was an incredible add-on that we did that I didn't know was going to happen. And it happened, and it was amazing, and it was the best thing ever. So, okay, I'm going to start with, this is the care messages. And what I wanted to show you on this one is how the care messages were developed. And I want to switch screens. Let me try something. If I move this right here, does your screen change or no? It did.
Yeah.
Okay, good. That makes it easier. So what this is how Gomo, we first started. So they created, and stay with me here because this looks like a lot, but this was extremely helpful to me. This isn't just an Excel spreadsheet that they sent to us. And down here are all of our programs. So this was, the one that I have highlighted is called Co-occurring Court. And then our ICWA Court, Family Recovery Court. So these were all the messages that, and then this is our day treatment program, IOP, that might look more familiar to you if you don't have courts. But so these were all the messages that they developed. So Gomo does all the heavy lifting. They created all of these messages. Then they sent it to us, and Annette and I went through them all and made sure that we agreed with the content. And I think that's important for you to know that you have control over it in your organization. So if it used words that our staff were uncomfortable with, we just changed them. if we wanted it to say, so if they want to talk about family, Rimrock has a big family week that we incorporate. And so we wanted to mention that. So we could modify these. So that I think was really helpful for us to know that we still had some control. There are several texts that have links in them, and the links were on here for us to confirm and look at. But again, they did all the research on that. We didn't have to do any of that. Here it tells us when that message is going to go to the client. So this was the 79th message that the client would get. And so I'll show you why that's useful later, but right now it's just pointing it out to you so you can see it in a little bit. But those were all the different options that we had in regards to our messages. These are the comments, some of the comments that I had made about making some changes. So it was a really interactive process that I thought was great. Okay. So when, oops, demand in a moment. Sorry. Why is that? Okay, I'm just gonna move on. Okay, so when they enroll a client, this was super easy. So our workflow is when a client comes into Rimrock, our case manager is the first person that meets with them. And so your workflow might be different, but this is what works for us. The case manager meets with the client, does all the releases, signs the orientation, all that admit paperwork that everybody has. And then we sign them up right at that moment in Gomo. And I wanted to show you what the actual enrollment looks like so you can see how easy that is. And it's customizable. So it's one page, it's web-based, so our case managers just pull it up, they fill it out, and they hit enroll. If there's an error in the enrollment, so say the phone number is incorrect or something didn't fill out right, this allows an email to go back to, it comes to me and it goes to the person who enrolled it, just because that's how we have it set up. So then I can follow up and say, hey, you missed something on this. Please make sure that you re-enroll them. And then these, I'm going to get into this in just a second, but these are our keywords. And so anything that we put on here can be customizable. These are the tracking information we want. These allow us additional pop-ups. So if I want to, Silverleaf is our treatment court program. So then this one says, do you want to be enrolled in Pathways to Parenting? This adds in the parenting questions, which I'll show you those. But they're just additional texts that are specific to children and the age of the kids. And Deena, if you want to jump in, because that's kind of a big piece, if you want to say more about that.
And it's highly personalized, because if you don't have children under the age of 18 and then you're getting messages about parenting, you're going to probably opt out of the program. And that's part of what makes Gomo so, our retention rate is like 93% or more in the Rimrock program, because you're not getting messages that aren't relatable to yourself. Smoking messages, if you're not a smoker, you're not getting quit messages. So that's why we ask so many of these personal questions in the enrollment forms.
Yep. Thank you. Explain that well. So then it would ask what level of care the client is going into, so that they know really this is the frequency of the messages and the level of messages, and you set that up. So we set it up that our day treatment program gets messages twice a week, whereas continuing care, which is, they wouldn't get messages as frequently. So that's how we are able to maneuver with that. When did they start? And this is because it's a timed based. And so we know how long we expect a client to be in treatment. And we provide a little bit of gap with that because we know it fluctuates. And then we want to know what court the client is in, because that determines the day that they attend court. And so one of the best things that we have in here, there are so many good pieces, but one of them is the night before a client goes to court, we send a text message that says, how are you feeling about court tomorrow? And that's probably the number one thing that peer support gets contacted on. Either the person says, I feel great about it, or I'm really nervous about it. I don't know what to wear. This is my first court. And peer support gets all of those messages, and then they can call and respond to it. So that's probably the one we get the most responses to.
And they're bi-directional messages. So
Yes.
they also ask them how they're feeling on a scale of 1 to 5. 1 being low and 5 being great. So that's when peer support gets triggered, if it's a 1 or 2 too, that someone will be reaching out to you in the next couple of hours. And to your point, I don't feel so good. You know, this is my first time. I don't have the proper clothes. I'm very nervous. And that's when peer support gets triggered.
Yep, perfect. Okay, so then I mentioned I would talk about the support person piece. The client can enroll a support person right away if they want. What we're finding is that the clients are a little reluctant to enroll their support person right away. What we have found, might be different elsewhere, but what we have found is that they think their mom or dad's going to get updates on their treatment. And that's not what it is. So it takes them a minute, but once they realize, oh, this isn't personal information, then they oftentimes want to come back, and it's very easy. Same enrollment form. We just say add a support person. And so that can be done at any time. It doesn't have to be done at the very first enrollment, which was really helpful to us. And so the support person, just to stay on that and finish that topic, they have their own set of messages down here, and they're see if you see it before me. Let's see. I was just playing, support person posts. And so they're more general to, like, this one is enabling doesn't mean we support a loved one's addiction. It can be excusing troubling behavior. So it's little tips on how to support a loved one, what to do, and then how to personal wellness, how to stay sane yourself, things like that.
We know this is a family disease and it's been years of it. And it's like how to support, but not, not be enabling in the same respect. So how for them to grow in this disease as well for the support people.
Yes. Okay, so then the phase update at the end of someone's treatment at one level of care, the next case manager who meets with the client then confirms that releases don't need to be updated, make sure that we have everything we need to start the next level of care. They go in and do what's called a phase update. This triggers Gomo to do two things. One, send them a welcome to day treatment or welcome to IOP text. And two, they get a survey. We call it a discharge survey, so that we know how we did on the previous level of care. And I'm going to show you the surveys in a minute, but the surveys have been invaluable to us with our stakeholders, because they are what clients, it's amazing what clients will type into a text when they think it goes out into the middle of nowhere and that we get to read. So it has been a better response than giving the clients a paper survey, which has been really helpful to us. Okay. And support person, I talked a little bit about that already. Okay, Gomo chat. This is the only one that I actually can't pull up online because it has the patient names in it. But this is the one. I'll let Annette talk a little bit about chat because she really runs this.
So we know that crisis doesn't happen Monday through Friday from 8 to 5. In fact, typically for our clients, they find themselves in a sticky situation, usually over the weekends when nobody's in the office, or, later in the evening when they're at home alone. And so what this has really been able to help us is to capture our clients while a trigger is happening, or while they're feeling like they want to use or want to talk to old friends. They've been able to send a chat and we can respond right away. We offer 24-hour on-call services, and so whatever peer is on call we'll get the incoming chat and be able to respond. And I think to that point is also, it's so hard for our clients to pick up the phone and ask for help. And what we found is that it's easier for them to engage when it's just a text, when there's nobody in front of them, when there's, when they just have to send a message and receive a message back. And so sometimes, we'll send a text back and ask them, would you like a phone call or would you just like to speak over text? And sometimes they choose a phone call and sometimes they continue to just communicate through text. It's also been helpful when we sign people up prior to coming into treatment. We've been able to, you know, capture people that are still actively using and fearful of coming into treatment and set up meetings that way or help them get through the doors of treatment. One other thing that I really enjoyed about this is that we've been able to build stronger relationships prior to them coming into treatment as well. So they know who we are, they're comfortable with us when we come in, and it seems to create a willingness to come to treatment that maybe wasn't there before.
There's one thing I just want to add on the chat from my behavioral science perspective is there are environmental things to consider. So someone may need to feel chat, but they may be around other people or an environment they don't want to step out. They don't want people to hear. Because so chatting, they could chat even if there's other folks around and get it off their chest, so to speak. So there's a lot of factors of why a mixed modality of chat and of course phone, you know, are needed in different scenarios.
Yeah, that's a good point. And this is just, these are just snips that I took off of our actual chat. Yesterday morning, we were putting this together. So these are actual comments that clients made.
And if you don't have a 24/7 peer support like Rimrock does, not everyone has that availability. We have, and if you want to meet with me separately, we'll get more in depth with it, but you can set your open and closed hours. And when you're closed, you would get a message just like your phone would. You know, this is beyond business hours, go to your nearest emergency department or call 911. But during open business hours, when someone's available to chat, your chat would be open and you could set those hours yourself.
Yep. Okay. Okay. So my very, very favorite part of Gomo is the companion. So with us, the companion started during COVID. So it was helpful to us because we had just transitioned everybody home and we needed a connection to for our telehealth. And so now, as I'm sure everybody that's providing treatment knows, going back 100% in person, now that people have tasted the Kool-Aid, you've still got people who want telehealth, and states are typically supporting telehealth ongoing. But we use this both in our hybrid telehealth and all of our in-person stuff. So what it is it's a companion page, and I think that describes it well in the fact that it's an accessory, if you will, to Gomo. It's a separate website that all of our clients have access to, and they all log in. And all of these are the different areas that are the text messages that they receive, the different links that they receive, plus additional information. So for instance, some of our counselors use it for assignments. For their clients if they have a client who's depressed, and they'll say, I want you to go on the mental health page in Companion. I want you to find something to help with your stress and present on a group tomorrow. So all of this can be done offline, outside of treatment, and then the clients can come in and talk about it, bring it back. The other piece that is fantastic with this that we did that not everyone will want to do, but was really helpful for us, is we put in videos of our staff meet the counselors, and then we did meet, let's see, is peer support under here, and our peer support, so that clients can see that before coming into treatment or before transitioning a different level of care. Here's our very own little tiny Annette and her little tiny video, and they're just quick.
My name is Annette. I'm the peer support specialist here at Rimrock, and I'm also a drug court graduate. I graduated in May of 2016. So I very much know the shoes you're walking right now. If there's one thing that I wish that I could relate to you, is that you likely signed a contract and were willing and asked to come into this program. So when you're offered the help, don't buck the system. Surrender to the program, surrender to the process, open, honest, and willing to keep putting one foot in front of the other.
Isn't she cute? Um, So we did that with all of our peers and all of our counselors so that the staff can, or the clients can access that and see them before they come into treatment. The other really great thing that took a lot of effort, this was one of the ways I was able to get our counselors to buy into utilizing Gomo, was we put all of our assignments, all of our task work on Companion. So we call them recovery journal assignments, but they are things that the clients can take and do from home. So our consequence list, our diagnostic checklist, and it comes with the instructions for how to do it, because many times clients will say, I didn't understand it, or they'll say, I lost it, I don't have it. And this allows them to, our counselors, to say, here it is. During COVID, we would have the counselors fill it out and then put it on the screen. And so we were able to have that interactive versus just having the client read, which is what we had been doing. Then they could put it on the screen, share their screen so that the rest of the group felt more interactive. And so that was really helpful for us. But it shows, again, I keep going back to how customizable this program is. And all we did was come up with the ideas and Gomo made it happen. I mean, it was really impressive how quickly and easily that happened. But these, again, all of our assignments that we have clients use can be done through the Companion. That's why the Companion is my favorite. It's the most interactive with the counselors. Annette probably likes the chat best because that's her most interactive. Okay. I digress. I could go on and on about the Companion. Okay. Then, too fast. Okay, so ask a question feature is a part of the Companion, which I should have mentioned this when I had it pulled up. It's one of the boxes that you click, and our clients typically use the chat. They haven't gotten much into this, just because they're quick on the chat piece of it, which is faster for them. But this is a feature that they could use. Okay. Okay, so data collection. If there's administrators on the call, this will probably be the most interesting to you, because this is what helped me to sell this to our judges, our treatment courts, our administration here at Rimrock, because it shows the benefit that the clients are receiving from our services, which then helps us get grants, which helps us to find other funding for non-fundable services. So we again set this up. This was our choice. So our quality of life survey goes out every 3 months for our long-term program. So the clients that are in services for 1 to 2 years, they get this every 3 months. The clients who are in services shorter term get this at the transition of care. So from inpatient to outpatient, remember I said they get a survey. These are the surveys that they get. So the quality of life survey is really simple. These are our questions that we created with Gomo. So you can change them, you can update them, but they're pretty simple. How would you rate your outlook, et cetera, et cetera. What we learned, one of the things that we added, I'll show you our data. So, oh, the admin page. Wanted to show you, I forgot to pull that up, but I'll get back to that one. Maybe I throw it to Annette really quick. But here's the data when I download it off of the admin page. This is what it looks like. And so I just took out the client name just so I could show this. But this gives me what program the client is in, what court they're in, and then the information that they gave. And so what I do once a quarter is I send these out to the treatment courts and the judges so they can see what their clients are saying. And there's opportunity over here for clients to write their own comments, talk about what they want to talk about. And it is surprising. It always surprises Annette and I what clients are willing to type into something like this. Then one thing we found, if anybody out there in TV world offers peer support services, what we found is it's really hard to quantify the value of peer support because peer support is an adjunct service. And so it's something that is usually added on to another service. So you don't know if it's which service is providing the benefit to the client. Well, we wanted to be able to try to separate out peers. So we added these questions, I think in January 2 years ago.
Yeah.
That are specific to what SAMHSA likes peers to be involved in, and asking what areas, oh, there's peer support right here. Go ahead.
Yeah, so basically we got to see how peer support was benefiting a person's recovery journey, and if at all they were helping a person in achieving their goals for whole person wellness. And so our goal is that we help you and guide you to strengthen every area of your life in your recovery journey, meaning your emotional, environmental, financial, intellectual, physical, social, and spiritual well-being. And so I think like my favorite part about this, really about this whole survey, is that when you follow a client, especially our people that are in our long-term programs, is you get to watch their answers change and their scores go up. And they really, a lot of the times will give feedback in their comment area about, you know, they come in and their scores are pretty low and everything about life really sucks, and they strongly disagree, that they're, you know, they're unhappy. And then, you know, in 3 months, that looks a little different and they're excited and jazzed about recovery. And in 6 months and in a year, pretty soon we're seeing all fives. It's, you know, peer support's having a significant impact. Their life's going well. Their kids are back in their lives, and just, it really captures a person's progress in recovery.
Thank you.
Yeah. One thing I just want to say, you know, from a cognitive action response behavior, is the reason why Rimrock running this program also gets more data than otherwise people would fill out surveys. A lot of clients or people serve feel, I'm getting a survey from my provider because they need it for some reimbursement, or need it. They don't really see how answering questions affects personal. So in this, to their point, the day before quarter or during a transition, they're getting how you doing or how you feeling. Based on their answer, it goes into chat, or they're saying, hey, I have children. They're getting parenting information. It's very personalized when they answer something. So they're more likely to be reciprocal, like an answer, as opposed to every once in a while we send a 30-question survey to them and you don't get a lot of response. I just want to point that out. There's a reason why they're getting the reciprocity, which also includes attendance, retention, completion rates, all those things. All right.
Yes, thank you. Okay, and then the how are you doing survey allows for escalations. Actually, both of them allow for escalations. And again, that's where our peer support team comes in. And so this was one of the barriers that we ran into, and that was one is, you know, on a slide coming up, is to talk to you about barriers. But one of the things I wanted to point out is initially getting the counselors on board with one more thing was more challenging than I thought that it was going to be. And how I got their buy-in was sitting down with them, basically doing a very similar type of presentation, showing them the effort, and then giving them control of the companion. What do we want in there? What assignments do you want in there? What videos do you want in there? And one of the pushbacks that they had regarding escalations was our plan was to have the escalations go to peer support. One, because peer support was on call 24 hours a day. So it would save, and our counselors are not on call. And so this would allow the client to have after hours support. The counselors felt like, well, we want to know what's going on with our clients. We want to know if there was an issue. So what we did was we had the escalation go to both people and to the counselor. Did we do all counselors at first? Mm-hmm. All 15 at Silverleaf, our treatment courts, and then the peer support. And oh my God, that was a huge mistake, because what happened was a client had an escalation and got like 8 phone calls. And that was a bit much. So we rolled it back and we turned it to just peer support, supervisor, and on-call phone, and then the supervisor of the counselors. And so then that counseling supervisor could review the escalation and send it to the primary counselor. So that was a lesson learned, is that everyone was really excited to respond, and we needed to slow our roll a little bit. But now we have these escalations. Annette's team responds to those. Do you want to talk about any of those or your experience with those?
Yeah, absolutely. So, we get notified when their escalation or it's come back, rating low. And so we've been able to, kind of capture clients that we're working with and we had no idea that they were struggling, and they weren't honest, or felt like they couldn't share, or we've been able to capture new clients as they come in and they're, things aren't going well for them. We've been able to capture clients before they relapsed or before they, a lot of the time it's, something came up with treatment. They don't want to come back to treatment. And they've answered honestly on this survey. And so we get the opportunity to talk them through that and be able to help them before they make a rash decision.
So the escalations have been helpful for our staff. So some of the outcomes that we have experienced and gotten through our living environment. So we started outcomes. Rimrock does natural outcomes, and what we did was we compared from prior to starting Gomo to after starting Gomo, and that's where we came up with these numbers. So we started in March of 2020, and so we looked at 2018, 19, and then we went 20, 21, 22 data to come up with this. So our 12% increase in self-esteem, our relapse rate was only 10% in 2021. No new arrests through our Silver Leaf program. Increase in full-time employment. The incomplete discharge status by the medical record had a 72% improvement, and our completion rate was 89%. And Rimrock's goal is always to be at a minimum of 75% completion rate. And so that was really exciting for us to see the connection that, like what Annette was saying, when a client indicates they don't want to come back to treatment and we can immediately get peer support on it. Peer support's just different. If you have peer support, you know what I mean. It's different than a counselor. It connects at clients at a different level.
One thing I just want to say on that, a 50% improvement in full-time employment, because as we all know, one of the big issues is either people feel like a victim or a loser or stigmatized. They, under the title of thinking errors, they can't be productive, they're not good to their children, all types of things. So, but when you start, because one of the topics we have, or we don't call it that, but our thinking errors using positive psychology, and by personalizing it, gets people to start believing self-trust, self-credibility. They start believing in themselves, which changes their outlook. And if we could get them back to full-time employment, think about the different psyche that person has now, right? And that's why you're seeing some of these other stats happen. Right. Yeah. Because now if I could feel productive, if I could feel good about myself, wow, that's a huge change. I just wanted to point that out. That's like a huge stat.
It's basically the higher you are, the more you have to fall. If you're laying on the rug, you don't have much to fall, so you don't have much to lose. If you've got, the stature of a job, insurance, paying your bills, you have a lot to lose at that point. So you start to build that credibility in yourself.
Right.
Yep. Thank you. Okay, so then some of the objections and what I'd be interested is the people out in the world, Zoom world, what are your objections when you look at this? What are the questions that are coming up in your head saying this won't work for us, or I find that hard to believe? I'd love to talk through any of that because we were there. We had all of this isn't going to work for us, or nobody's going to buy into this, and we were able to maneuver through that. These are a couple of ways that we did that. We had to have an internal champion, and that's what would get our staff excited. And at Rimrock, that started out to be me and Annette, and we became the internal champions. And we quickly realized that that wasn't enough, that we could get it because I'm the COO, so I had the buy-in from the top, but we needed to have the buy-in from the middle level of my counselors. And so getting a champion within their department. So who your leaders are, your informal leaders in your department, who the rest of the counselors listen to. I knew I had to get their buy-in. And initially they hated it and I had lost them. And so I pulled them off separately. We ran through all this. I gave them the companion control. And then all of a sudden they just fell in love with it. And they're the ones who put all the work into putting our assignments together, sending those off. In fact, it was their idea to do that. And so finding those internal champions is what knocked it out of the park for us. We had to have leadership support because it does take effort. One of the things that we found was initially we were struggling to get people to respond to the quality of life surveys. And so we added a text that said, if you respond, you get a coffee card. And of course, that was an added cost for us, but the benefit of it was all this data. And so we had to have leadership support in order to take on that $5 coffee card. And holy smokes, our data went through the roof, and we're still doing that. We've just decided that's a cost we'll incur because that's what we want to do and we want the data. And we started this slow. We started it in our treatment court programs, which has about 190 clients in those courts. And then about 6 months later, we added all of our outpatient services up top. We call it up top at our main facility and our mental health services, just because the talk was so big among the treatment court staff saying, look at what we heard, this is what we're doing, or this is how we're managing telehealth groups. And so all the staff wanted it. So it was pretty quickly that we added everybody else. Creating the workflow to make it as easy as possible. And case managers are amazing. Case managers never let you down. They work their butts off. So for us, it was a natural fit to put the enrollment on the case managers. If we would have put the enrollment on the counselors, it wouldn't have happened. It had to be an easy way that didn't add work to your higher paid staff. And so by putting it on the case managers, they loved it. They can communicate with the clients. They can remind that they can send a chat that says, hey, your appointment's tomorrow, or your counselor's sick today, please don't come in. So it saved them work. And so they actually like that better. Your informal influencers, those were the informal leaders I talked about. And then follow-up. So a lesson learned that we had for follow-up was Annette and I stayed really, really involved right off the bat. And then we're not as involved anymore because it runs itself at this point. But in the beginning, we had to be involved. And one thing that we figured out, and we continued to meet with Gomo regularly. So we were noticing, and Gomo was noticing, that we had a lot of people opting out. And so that's an option. When they get the first text, it can opt out. And we had all these people opting out. And we're like, what the heck? And we realized we had too many text messages going at a certain time. So we said, let's pull back on those. We made a real-time change. And then we went like 2.5 years without an opt-out. I think it was June of 2020 that was our last opt-out. And it was impressive. So that real-time follow-up and saying what's going on, and then monitoring staff turnover, things like that. Those were the ways that we addressed the barriers. Any others that you can think of? Okay. So I'd be curious, well, Bob or Deena, if you have any other thoughts on that, and then if anybody out in the world has comments or things that you think will be unique to your organization that maybe Gomo can help with.
Yeah, so you could stop the sharing, Coralee. Let's see if there's any questions or anyone wants to comment on how they think they could use it, or whatever anyone wants to say would be great.
The only thing that I want to share is that, anecdotally, back in my days when I was doing treatment for a women's treatment program, it was back before smartphones and everything else. I wish that this had existed. I really do, because we know that the more touches our clients get, the more availability they have to us, the better people do. And they need constant contact. And this web-based platform, which is what we do, not an app, nothing to download, no passwords to remember, no face to recognize. It's reaching out to you, to your clients, to your consumers on a regular basis. So they're not remembering to reach out to like a Weight Watchers app and put in how many steps they did. The messages are coming to them on a regular basis. So you're touching them, even though you're not touching them. When you're not working on a Friday night, on a Saturday afternoon, it's coming out to them. and talking to them and reminding them and sending out reminders and conversations about healthy living and going to meetings and resources in the area. With the court treatments, Coralee and Annette, we sent out like Salvation Army resources in their specific area where they could get clothing for court for that next week. That was really important. It showed that we cared. We, the Universal, Rimrock, Gomo, we cared about them, where food banks were in the area. So it's constant touching of these people that makes our clients do well. So again, I just wish it had existed back in the day. And, you know, as we get smarter, as we get better, our clients and consumers do better.
Any thoughts, questions, comments? How did Coralee and Annette do, by the way, everybody?
They always do fabulous.
Thanks, Deena. Deena's our biggest
Deena.
cheerleader.
And so do you want me to talk about the Discover's
Oh.
voucher?
Yeah. Do you need me to
Okay.
pull that slide back up or are you good?
I'm Kristen here from Gomo, and I'm just going to mention, they didn't talk a ton about it, but this recovery pathways follows the client 12 months post, when they post completion. So when they leave treatment, they're still getting the messages, still getting the support, still getting the how are you doing. And I had the privilege of interviewing a couple of graduates a couple of weeks ago, and just trying to learn what they're valuing about that aftercare. And they talked about how important getting that how are you doing message was to them in, now that they're out on their own without all the treatment supports. And then back to your talking about the companion, Coralee, just the access to kind of those resources, like, okay, I'm going to remember that relaxation technique. I'm going to remember that the music, Gomo's got music in our programs available. Somebody talked about just being able to find the music they need for short meditation. And so anyway, I think that 12 months post completion is also really helpful.
Yeah, thanks, Kristen. I've forgotten to mention that.
Do we have any other questions for our presenters or for Gomo or about the Discovers program? Oh, there we go. I was going to just say, who wants to talk about this from Gomo? Please do.
I will address this. So DMAS is offering a $20,000 voucher. It's not a grant, so it is available to any SUD providers. So there's nothing to apply for. It's a one-pager. We've done it with a couple of other programs in New Jersey already. We are more than happy to help you fill it out. Again, it's one page, very easy to fill out. The 20,000 is available to you. Anybody that's on this call, June, I think this was only sent out to anyone who it's available to.
Right.
And we will offer the 1-year program of this to anyone that fills out the voucher. And we're happy to start the program. Once you fill out the voucher, the money obviously doesn't come in the next week, but we will start building the program with you before you receive the money, because we know how the state works. And sorry, state people, it's not coming next week. It takes a little bit of time, but we will start working with you, build our team on our side. You build a little team on your side. We work together. We have weekly meetings, and we'll get the program up and running on your side. It's white labeled, so everything looks like it's coming from you. So everywhere that you saw Rimrock was, on the programs, it would have your company logo, your company colors, everything on your side. So that takes a little bit of time to build on our end. I see Lisa Dean has her hand raised.
And
I answered the question. Lisa was asking about the actual voucher. So for anybody else also on this call, this is Gary Pollack from Gomo Health. You can reach out to either Deena or myself. I put our emails in there, and we'll certainly help you if you want to look at this.
And this is Bob, just one other comment for everyone to think about that's not normally talked about from a P&L perspective and a joy in practice. I think clearly you heard, and so Annette, if you spoke to the counselors there's definitely brought back joy in practice, because it turned their program from either a IOP, OP, court into a lifestyle program where they were cognitively with people at home, work, and play, but not physically. And the data they get, the feedback, it brought back joy in practice to the staff at Rimrock and also to the judges, law enforcement, others. So that's interesting. And then the second thing is, in terms of retention of your staff, scalability, you know, a lot of behavioral health organizations are looking at how can we handle more people without, you know, tons more staff that we can't afford based on the reimbursements. So Gomo definitely enables you to engage more people because, as Coralee and Annette said, we're doing 95% of the work outside of the appointment. So, you know, it could allow you to increase the amount of patients, actually increase quality of care, and do it with the same people. So I just want to point that out. There's other types of financial benefits to it. All right, I'm done babbling now.
Okay.
All right.
I answered, I got a question from Michelle Wolf. It's actually for everyone, but will the presentation be offered again? You'd like your IT person to watch it. So I will make the recording available to everyone that is here. And I'm sure that, you know, Bob and Gary and Deena, you know, we might be able to do something else about another presentation. So we will discuss that, and you know, we'll let you know. But the presentation will be, I'll post it on YouTube, on our NJAMHAA channel, and it will be available to actually anybody that would like to see it. So I'll get that address out to everybody after the recording is sent up.
Gary also put our emails, mine and Gary's emails, in the chat, so you can feel free to reach out to us to set up a demo. We won't do it as well as Coralee and Annette, but we'll try our best.
Great.
Yeah, thank you, Coralee and Annette.
Thank you guys.
Awesome.
This was fun. Yeah.
We're happy to share the PowerPoint as well. I don't know if you want to mail that out, but the PowerPoint, I think, has a contact information on it as well.
Sure. So just send it to me and I'll be happy to include that as well.
Thank you.
Sure.
Hi, this is Suzanne. Did anyone in New Jersey have Gomo Health? Is there any provider here, said provider?
Yeah, so
Not anyone on this call.
we work, so we do 4 or 5 different programs with Bridgeway Rehabilitation, a lot of different, they're partial day, they're a lot of SAMHSA programs Gomo manages. We also the engagement partner for all the warm lines and hotlines for the Mental Health Association in New Jersey, Bob Clay. And if any of you going to the gala event next week, Deena and Gary will see you there. But we also ran, with support from the governor and NJAMHAA, we ran the Hope and Healing program during COVID for people with any anxiety, mental health issues. And then we have other behavioral programs with some of the New Jersey hospitals, RWJB, and we're actually launching, we have a program around IDDD and other behavioral issues we're launching with Hackensack throughout the state. So we have a few others.
The Central Jersey Family Health Consortium, too, we have a few programs.
Yeah, we run for the state with CJFHC, the Mom's Mood Disorder program. It's all on Gomo.
And also
In fact,
South Jersey Perinatal.
we've gotten unbelievable feedback on that. We have over almost 2,000 women in that program now.
Mhm.
The Mom's Mood, you know, it's really growing.
Perinatal mood and anxiety disorder program.
Yeah, and Bob, I also want to say we have South Jersey Perinatal. I think someone's on the call from there too. So we do a number of programs with them.
Yeah.
Great.
And we're also launching a program with the Tigger Foundation, the Tigger Stavola Foundation, which is going live in about 2 weeks.
Yeah, that's for mental health and drug education program for about
Mention,
55
And we're working with
high
other
schools
schools
in New
Monmouth
Jersey.
and Madison County.
Yeah. Suzanne, so see, we're doing a few things.
Just a few.
Okay, thank you.
You're welcome.
All right, we're coming on the 2:57 mark. You guys have any other questions you might want to ask Gomo or Rimrock or the folks from Rimrock? I was very impressed with how Rimrock has rolled this out. It was the first, I've seen your presentations before for Gomo, but I think actually seeing a provider use it and the feedback and the outcomes that they get from it, I think in and of itself is, well, to me, that seals the deal, but I'm not a provider, so I can't buy it. But we'll have another conversation. I know, I think it's Gary, I think we have a meeting set up in November with you to discuss something else. So we'll see how we can work together. If there are no other questions, I'd like to thank the presenters from Rimrock. Thank you very much for your time. I want to thank Gomo, obviously, as a NJAMHAA member. And I would like to thank Suzanne Boris and the Division of Mental Health and Addiction Services for their ongoing support of the IT project at NJAMHAA. Thank you all. Have a lovely, lovely day. I will make sure that everyone gets a copy of the YouTube and the PowerPoint. So bye, Suzanne.
Bye.
Bye. Thank you.
Sure. Bye-bye.